All right, we're going to get started. So hi, everybody. My name is Laura Barker. I'm with the communication team here at Stonerise, and I'll be the moderator today. Just a few things before we get started for those of you not used to webinars. So the chat function today has been disabled, but you'll be able to ask us question through the Q&A feature on your screen. So please feel free to ask questions throughout. We're not going to address them till the very end, but we have allowed some time for Q&A. So I'm going to pass this over to Larry Pack, who is the CEO of Stonerise Healthcare. Larry?
Great. Thank you, Laura. Hello, everyone. I'm so glad to be with you today to talk about really exciting opportunity and really maybe one of the most important developments, medical developments in our history, at least our history for many years, the COVID-19 vaccine. You know, this has been a really tough year for all of us, particularly those of you that are working the front lines, for our families, for our patients. But I think today, what we'll be talking about is a light at the end of the tunnel. So it's very exciting. I'm joined today by my colleague, Dr. James Malone. Dr. Malone is our Chief Medical Director, and he wears many hats as a physician in the Bridgeport community. So we're thankful to have him with us. We're both very passionate about the vaccine and just look forward for the opportunity to talk to you about it and also just share with you why we think it's important that each and every one of us get the vaccine. But before we hand over to Dr. Malone to talk about all the science stuff of the vaccine, of which would be very laughable if I was doing it, I'd like to talk to you just a little bit about the why. You know, why should we get the vaccine? Why should we get vaccinated? Why is it important? And that's a question I'd like to talk about. Of course, you know, we all want to do it for ourselves. You know, for our families. I have an elderly mother, I have a wife, I have children, grandchildren. I'm going to get a vaccine for them. I want to take care of them. I want to protect them. I want to hug my mother. So I'm so excited for this opportunity. We also want to do it for our patients. We want to keep our patients safe. They're our most vulnerable, as we know, as we've experienced, and they deserve our protection. They deserve us to do everything we can to take care of them. I also want to do it. I want to do it in hope of just stopping the vaccine, of stopping the spread in the community. I get asked a lot about, you know, is this a nursing home problem? Is this a hospital problem or a healthcare problem? No, this is a community problem. If we can't stop the community spread, we're not going to stop the pandemic. The vaccine is the way out of this pandemic. And finally, we should get a vaccine to set an example. We're all leaders, leaders of our families, leaders in our communities, leaders at Stonerise, leaders of our group at work. The best thing we can do is show leadership, is to show people that this is a safe vaccine. This is our way out of this pandemic. And so if they see us doing it, see all of us doing it collectively, others will follow. So it's just a great opportunity to get the vaccine, to take care of our family, to take care of our patients in our community, and at the same time show leadership. And so now I want to turn it over to Dr. Malone to talk about the science. Take it over.
Thank you. Thank you, Larry. I appreciate the opportunity to be speaking to everybody. And, you know, Larry, you're so right. This is an exciting time, and this has been a passion of mine over the last 10 months, watching the science behind the vaccinations unfold. And there is indeed light at the end of this very dark tunnel that we've been experiencing for the past 10 months. And before I go to the exact slide, I want to bring you to a little story that occurred during my residency some 30 years ago by my mentor, Dr. Robert Hess. He was my mentor for many years, and one day during my first few days of residency, as I thought I was saving the world by writing antibiotics and different prescriptions, Dr. Hess asked me a question. He said, Malone, name 2 advances that have occurred in 2,000 years since Jesus walked the earth. And I started naming off all of these medications and these treatments, and he said, no, you're not getting what I'm talking about. Tell me 2 things that prevent disease, the only two things that have been produced by science in 2,000 years. I was at a blank. That wasn't what I learned in medical school. And he went on to say, well, the first advancement is hygiene, because hands down, hygiene prevents disease. If you go back to the dawn of man, as we improve hygiene through various infrastructures in our society, it prevents disease. And if you think back to the beginning of this pandemic, we have been talking about hygiene. We've been talking about sanitizing your hands, washing your hands. We've been talking about masks. Although you may not think about masks as hygiene, it is. Why? Well, because as we know, these viral particles are carried on droplets out of our nose, out of our mouth. You wear a mask, it prevents the droplets, decreases the ability of the droplets to infect somebody else. That's hygiene. Social distancing, avoiding large crowds, that's all part of good hygiene. Hygiene prevents disease. And finally, we're actually getting to the light at the end of the tunnel, which are the vaccines. And that's what I really want to give a little talk to today that I entitle Hope, Motivation, and Education. So getting on to those vaccines, the first two that we'll talk about, and the only two that I'll talk about today, are the first two to be released. The FDA Advisory Committee yesterday approved the first of these, and that was the Pfizer BioNTech vaccine that you've heard so much about. And we're awaiting the FDA to give the final green light for shipment tomorrow morning, possibly as early as this afternoon. The second vaccine, which will be discussed by the FDA next week, is from Moderna. Both of those vaccines are very similar. The efficacy, which is the ability of a vaccine to prevent disease and illness, is 95% in the Pfizer vaccine and over 94% in the Moderna vaccine. And the studies that were created for these two vaccines since the onset of Operation Warp Speed back in March entailed over 65,000 people between these two vaccines and these two companies. And the studies incorporated people from a wide variety of life, ages 18 all the way up to 85 years of age. In the Pfizer study, 45% of the people were 56 to 85 years old. And in the Moderna study, 23% were greater than 65 years old. It was racially diverse, ethnically diverse, and they wanted to make certain that they included all ages in these vaccines. Going on, we're going to talk about these first two vaccines, but I want to answer three questions. And three questions that I have received throughout my entire 6-7 months about patients who have been reading about the vaccines as well. Do they contain the COVID-19 virus? In other words, can you get sick from them? No, they cannot. The viruses contain no live, no inactivated virus, the vaccines. The vaccines cannot give you COVID-19, and they do not in any way, shape, or form change your own DNA. Three very important questions, and keep those in mind as we go on to talk about these vaccines. For our purposes, I'll talk about two general types of vaccines and how they are produced. The first type is what I like to call the old-fashioned way, or the whole pathogen vaccine. These traditional vaccines consist of entire pathogens or entire viruses which have been killed or weakened. The easiest way to think about that is if you take a jellyfish and you cut off its tentacles, the jellyfish is still alive, but it can't harm you. And that's the way traditional vaccines, such as the flu vaccine, have been made. These types of vaccines elicit a very strong immune response, meaning they create a good antibody response to prevent the disease. And keep in mind, when we're talking about these whole pathogen vaccines, and I'll get into this a little bit later, typical year, a typical flu vaccine can effectively prevent illness in 40 to 60% of individuals. Many of the vaccines in clinical use today fall into this whole pathogen vaccine. However, not every disease or disease-causing microbe, which is a virus, can effectively target itself with a whole pathogen vaccine. So the next one that we'll talk about, which I find extremely exciting, is what we call the nucleic acid vaccines. Those vaccines, of which Moderna and Pfizer have involved itself with these days, involve introducing a genetic material, encoding the antigen. An antigen is a virus. It's anything that can cause an immune response. So you get this RNA of the virus, you inject it, and it causes an immediate immune response in your body to produce antibodies to fight off a potential foreign invader later. Now, this vaccine has many advantages, including the stimulation of broad, long-term immune responses, excellent vaccine stability, and we can relatively easily produce large-scale numbers of vaccines as compared to those whole vaccine pathogens that we talked about a little bit earlier. The messenger RNA method that Pfizer and Moderna have used is part of this nucleic acid vaccine. Just to give you a brief overview, I've got a little cartoon kind of, you can study that if you'd like, but I'd really like to get to the messenger RNA benefits. They're tremendous. Number one, vaccines made with this messenger RNA process are non-infectious. There are no particles of the virus, the pathogen, in this vaccine. Second, they do not enter the nucleus of your cell. The nucleus is where we have our DNA. So you've heard rumors in the past that it might interact with your DNA. It does not, it cannot. Thirdly, there is no cancer-causing potential of this vaccine whatsoever, zero. And even more importantly, what a lot of people don't realize is that this vaccine, after it is vaccinated, introduced into your body, rapidly decays after it causes immune response, meaning there is no trace of the vaccine later. Therefore, long-term adverse effects are virtually none. Just to give you a brief overview, once again, of what I've said about the nucleic acid or the messenger RNA vaccine, there is no virus injected into your body, none. No live virus, no weakened virus, no dead virus. I want you to remember that little spike molecule that we've seen so much of, and you see a picture of it there on the slide. So those spikes are what attach themselves to the linings of your lungs, which actually then go on to cause the infection. So think of this vaccine as a genetic wrapper of that virus that is injected into your body that then allows your body to identify that wrapper when the real virus gets in. And this next slide will actually show you, it's an ingenious slide created by a colleague of mine, Mr. Christopher Bailey. You know what that is. Already, I guarantee you, 100% of you can smell that cheesy Dorito, can taste that crunchy taste. I can. I'm going to run out and buy a bag after I'm done here, actually. So you don't know what it is, but the mere picture of it, that wrapper, elicited your mouth to start salivating. You can smell a little bit of it. So your body had a response, even though you did not consume the chip. That's what this virus does. That's what this vaccine does, excuse me. It elicits a response without injecting the virus. Your body then produces the antibody. It's ready for duty when needed. Side effects. Everybody wants to know side effects of everything, which you should know. So overall, less than 2% of people in the phase 3 trials, which are the end trials in these companies' trials, had side effects. In the Pfizer trial, headache accounted for about 2%, fatigue accounted for about 3.8%. These side effects lasted anywhere from 24 to 48 hours and were gone after that. Remember what I told you about that vaccine after it's injected? It dissipates, it burns itself out very quickly. In the Moderna, slightly higher, but still very low. We had headache in about 4% and fatigue in about 9 to 9.5% of the participants. And again, these adverse effects lasted anywhere from 24 to 48 hours, which if you look back historically at all vaccines, that's pretty much typical of any vaccine, from the flu vaccine dating back to the vaccines that our children received when they were young toddlers and infants. Once again, I cannot emphasize this enough. The vaccines cannot give you COVID. They do not contain any virus. They cannot cause you to be sick. The Pfizer vaccine is composed of 2 doses. The first one, 3 weeks later, you get a booster. The Moderna, 2 doses. First dose, 4 weeks later, you get a booster. Up to 1 in 10 people may have short-term discomfort, 24 to 48 hours, fatigue, headache, some muscle pain. Again, no more than what you see in a regular vaccine. And if you think about side effects, it's kind of like what I always told people about fevers when you had a little bit of a virus, not the COVID virus, but a fever means that your body is producing things to help fight off the infection. So the side effect means that your body is doing its job. It's making the antibodies. They're common, they're expected. They are no more different than the typical vaccine side effects you see from the flu vaccine or anything else. Important. I cannot emphasize this enough. You get the first dose to get you to the second dose. In other words, you will not be protected if you only get 1 dose. It is vitally important that you get your second dose, which is the booster dose. And the next slide will tell you a little bit about why we get those second doses after this. The FDA is one of the leading authorities in the world on producing strict standards for medications and vaccines. When Operation Warp Speed was enacted with the FDA back in March, they used the same strict standards it has for decades. No skips or steps were skipped. People ask me, how did we produce this vaccine so quickly? Actually, it wasn't that quick. Back in 2009, when we had the H1N1 or swine flu circulating around a pandemic, we actually received that vaccine in approximately 3 months. This one took over 10 months. The most difficult part about creating a vaccine is getting the genetic code for the virus. We had the genetic code for SARS-CoV-2, which is the virus that causes COVID-19, in mid-January. So a global effort with the world's leading scientists focused on the same task, to produce a safe and efficacious vaccine for the entire world. Does it work? Going back to those first slides, the Pfizer vaccine showed a 95% efficacy. The Moderna vaccine slightly over 94%. And you remember what I said earlier about the whole pathogen vaccines? Every year, the flu vaccine or influenza vaccine produces efficacy somewhere between 40 and 60%. The 2019 influenza vaccine was approximately 45% effective. And we know for a fact that it markedly reduces hospitalization, illness, and death. So think about it. If the flu vaccine at 45% markedly reduces hospitalization, illness, and death, just think what a vaccine at 95 or 94% can do. Do you still need to wear a mask? Everybody is tired of the masks. Everybody asks me the same question. When I get the vaccine, can I get rid of the mask? Not yet. We need to wear the masks even after we get the vaccines. Why? Well, several reasons. Number one, it does take you a couple of weeks to start building your antibody response to the vaccines, therefore protecting you from getting COVID-19. Number two, until we get at least 60% of the population inoculated, combining that, and I say combining it, with already produced immunity from those who have had COVID-19, we're going to need to wear the masks, not to protect us, to protect others. Just as Larry mentioned earlier, I don't wear my mask to protect me. I'm not worried about me. I'm worried about my parents, my patients, my children, my grandchildren. I'm going to get the vaccine because I'm concerned about my patients, my residents in my facilities, my parents, my grandchildren. So yes, we will wear the mask for now. When we get enough people vaccinated, when the pandemic is declared over with by the WHO, by the CDC, we will then get rid of those masks.
Thank you so much, Dr. Malone. That was very helpful, and I'm sure that we'll have some follow-up questions in just a few minutes. But I'd like to close out a little bit, talking some more about the why, and just emphasizing why we're going to do that. And I think it starts with not forgetting everything we went through, and not forgetting as to why we do most anything to get out of this. Since the pandemic started in West Virginia, we've had really over 900 deaths now. It's just accumulating every day. We'll hit 1,000 before Christmas, and not sure where we're going to end. Most everybody now in West Virginia has a story, even those outside of healthcare, of a family member or friend who has been impacted by this virus. About 90% of the skilled nursing centers in the state have been hit with this virus, and assisted living centers as well. So it's not just us; it's everywhere. That's one of the things that we do, and of course, every community that we're in around the state has substantial community spread now. So we worried back in the summer that we had 500 or 600 cases, active cases around the state, and now we're over 20,000. So we can't forget where we're at, and we definitely don't want our neighbors to forget as well. The next thing I want to talk about a little bit is just a little story about a patient that we have in Martinsburg, and kind of the things that she had sent us as testimonial and allowed us to share it. And I want to read it to you. But Margaret says, "I'm 93 and I like to live to 100. but I can't live to 100 without laying in this room. I've got to get up. I got to get my exercise, and I miss people. I'm going to take the vaccine for Margaret and people like her. So please help us make the turn. This is the opportunity to get out of this pandemic. We can eliminate it. We have the power to end it. If we all get the vaccine, we can make a turn to get us out of the pandemic. We can make a really big impact on our communities. But if the vaccine is not embraced, the pandemic will continue. And really at the end, there's no better way to show love to our family, to our patients and our community by getting the vaccine, by being a leader in this effort, not only inside of Stonerise, but outside of Stonerise. Again, another, I think, really big reason to take the vaccine. And I just ask all of you to join us in this and taking this vaccine and lead. You know, West Virginia will be the on the forefront in the nation as far as being able to vaccinate all the patients in long-term care and assisted living, and all our employees and co-workers. It's what a blessing. We're very thankful for this opportunity. So we're going to show leadership not only in West Virginia, but we show leadership all across the United States. So thank you so much. I'm going to turn it back over to Laura.
Thanks, Larry. Thanks, Dr. Malone. We really appreciate it. We've got a bunch of questions trickling in, so let's get started. The first question, is the vaccine mandatory?
Larry, I'll take this. No,
Sure,
it is not mandatory at this point in time. And, you know, in looking at the United States in general, it's really difficult to make a mandate and to enforce a mandate such as saying you have to take a vaccination. That's why I want to do my best as a physician, as a member of our community and our state, to encourage people to take the vaccine. And like Larry said, not for us, but for others.
Thanks, Dr. Malone. I've got one more for you. Actually, a lot of these are for you. So an anonymous attendee says, my dad already had COVID. Can he get it again? And if not, would he still need the vaccine?
Great question. So to answer the first part of that question, if you have already had COVID, can you get it again? And the answer is yes. The probability is low, but worldwide to date, in my limited knowledge of resources and reading, there have been approximately 40 to 50 people worldwide who have reported contracting it again. Just like influenza or most viruses, if your body does manufacture antibodies naturally, we don't know how long they stick around. If you get the flu in the fall, you can potentially get it again. So yes, you can get COVID twice, although not likely. Is the vaccine recommended for those who have had COVID? Yes, it is.
Great, thank you. One more from Lois Mullins. Lois is asking, which vaccine will be distributed across West Virginia based on the two that you described, or do we know that yet?
So the first vaccine to be distributed will be the Pfizer vaccine. And again, we're waiting on the final green light from the FDA. It is actually loaded, ready to go to the various states and communities when the FDA gives us the approval, either later this evening or tomorrow morning. The second vaccine will be discussed next Thursday by the FDA, and hopefully we all feel that it will be approved shortly thereafter. And then the other two that we did not discuss will be reviewed in mid and late January.
Okay. And Dr. Malone, again for you, is the vaccine safe during pregnancy?
So the studies are still ongoing with pregnancy and pregnant women. We are set to review that later December and January. The FDA and the Advisory Committee on Immunization Practices in the United States have not yet given their guidance on pregnant females. So they're saying at this point in time to hold off, but they will give a reading later on.
Okay. And then what about those people who have allergies? Are they at risk if they receive the vaccine, especially with our elderly generation?
So to date in the study, there were no significant allergic reactions. There were no contraindications to people who have had previous allergies. Even the flu vaccine, which previously had been contraindicated, meaning don't give it to people who have had egg allergy, that was withdrawn. So I had a question myself from a patient earlier today that said she had a real allergy to the flu vaccine. Could she still take the COVID vaccine? And the answer is yes.
Okay. And thanks everyone for the questions. I'm up to 33 now, so we're gonna see
Great.
how many we can get through. This is from Casey. Is there a certain age that you should not get the vaccine?
Well, it's indicated now for 18 and up. The advisory panel committee is actually considering it over the next 4 weeks for children younger than 18. And the only reason it limited and stopped at age 18, those were the participants in the study. It's difficult to get children or young adults younger than 18 into a study. So for right now, 18 and older.
Okay. And this is from Joey, and we're flipping around a little bit, guys, because I've got so many to read here. Joey asked, is the vaccine safe for breastfeeding mothers? Do we know that yet?
Again, going with pregnancy and breastfeeding, no data on it yet. The consideration is that yes, it will be safe for breastfeeding mothers, but we do expect exact guidance on that within the next 72 hours or so.
Okay. And this is from Nancy. My mom is 96. She did have the virus, but she didn't have any complications with it. Her doctor has advised not to have the vaccine due to her age, plus she already had the virus. What's your comment on this, Dr. Malone?
Well, I can tell you from personal experience, the oldest person in my practice is 102, and she is sharper than me. And she asked me the other day whether she should receive the vaccine. And I gave her 2 thumbs up because she was a little bit hard of hearing. So she looked at me and said, so that means I should? And I said, absolutely so. Yes.
Okay, thank you. I think you touched on this a little bit, but will the vaccine be given every year, like the flu vaccine, or is it like the measles vaccine in one time and we're done?
That's a great question. And we're going to have to wait until the studies continue to actually answer that. But I will give you a personal opinion. So after we achieve herd immunity with greater than 60% vaccination of our population, and then hopefully that pandemic will be ended, one of 2 things will happen. Either the virus COVID-19 SARS-CoV-2 will hopefully go away, or it will come back every so often, yearly, every 3 to 5 years. Only God knows at this point in time. But if it does, we will have the vaccine in place, just like we do for influenza. So more to come on that in the coming months.
Okay. Is the vaccine contraindicated for those with compromised immune systems or those such as transplant patients?
No, it is not. Absolutely not. And we will definitely hear more about that in the coming days because those people are in particular more susceptible to the negative effects of COVID-19. So not contraindicated in immunocompromised people.
Okay. That one's kind of similar. Kristen Simpson's asking, is it a one-time 2-dose vaccine? Or is this yearly? I think you covered the yearly part, but can you just emphasize again the 2 doses?
Correct. So the Pfizer vaccine, which is the one that we're waiting on approval tomorrow, you get the first vaccine and then 3 weeks later, you'll get the booster. And then from the Moderna vaccine, when it is approved, it is the first dose followed 4 weeks later by the booster.
Okay. And this is a little bit more on allergic reactions. This is from Karen Castleberry. What about allergic reactions to someone that has to use an EpiPen and has reactions easily to things that cause hives and swelling in the face? Is that a concern?
Typically, no. So once again, there were no significant adverse allergic reactions in the trials. I'll just bring up, you probably heard about, and she may be alluding to the 2 people in Great Britain who had an anaphylactic, which is a severe reaction to the vaccine, but those 2 people had previous allergic reactions to all sorts of vaccines and other medications. Previously, they have a latex allergy and the needle has to go through the hub of the vial. So if you do have a latex allergy, you need to inform a severe latex allergy. You need to inform the person giving the vaccine to you of that, and measures can be taken.
Okay. And either Larry or Dr. Malone can take this one. We're leaving Larry out a little bit.
That's all right.
Is the vaccine mandatory for residents / patients in our Stonerise centers?
No, it's not. It's not mandatory, but we are strongly encouraging it. But it is not mandatory. We believe that most, well over 90% though, will make the decision to have the vaccine.
Okay, thank you, Larry. Dr. Malone, this is from Lynn Bain. It's flu season. Can I get the flu vaccine and COVID vaccine close together in terms of time frame?
So typically what I'm recommending for my patients is that preferably they wait at least 2 weeks from the time of getting the flu vaccine, preferably 4. And the only reason for that is not to overtax the body's own immune system to produce 2 different type of antibodies at once. There's no true contraindication to it. So if you get the flu vaccine now and you're available to get the COVID vaccine in 2 to 4 weeks, please feel free to do so.
Okay. This is another anonymous question. I've heard that there are multiple strands of COVID. If that's true, will this vaccine protect against all strands?
Awesome question, actually. So what we've seen, if you look at the original molecule, that little spiked ugly molecule from Wuhan, Los Angeles, and New York, which were early in the pandemic, and you compare it to the different strain or different virus that we see now, the main difference, the main mutations is that we've seen a little bit fewer spikes. Same virus, same genetic makeup, fewer spikes on it. So the vaccine will still protect no matter what.
Larry, you might want to take this one. This is from Lois Mullins. So after our mother gets the vaccine, how much longer are we going to have to continue to wait before we can come and see her?
Well, this current visitation parameters, requirements are all related to the outbreak in the communities. So the quicker we reduce the outbreak in the communities, the sooner we can get back in on visitation. I'm a big advocate for visitation. If we can turn the corner on the community stuff, I'll be fighting really hard with both in the state and national to allow us to open that back up.
Okay. Dr. Malone, this is from John Rasana. John, I hope I'm saying your last name right. He's asking, isn't it correct that if you receive the Pfizer dose, you must also receive the same Pfizer dose the second time?
That's correct. Absolutely so. And the distribution, the vaccination clinics, which we set up, they have a process in place to ensure that you will receive the same booster as the original starter dose that you received first.
Okay. One more anonymous question. Dr. Malone, I think you touched on this, but could you say again, what are the other vaccines that have used the messenger RNA method?
So, although not the direct messenger RNA, the Shingrix vaccine, which is a shingles vaccine, uses a very, very similar process as the messenger RNA developed by Pfizer and Moderna. And
Okay.
the shingles vaccine, the Shingrix vaccine, has been out for many years.
Okay, thank you. Another anonymous one for Dr. Malone. I just recovered from COVID. Can I get the vaccine next week?
Yes. If you have recovered, you're greater than 21 days, absolutely.
Okay, thank you. We have a lot of questions here, Dr. Malone. I just want to acknowledge for the group. There's a lot of questions coming on infertility, links, looking for study, non-pregnant women. So you touched on this, Dr. Malone. I think maybe if we could just give people some reassurance that once we've received more information on that, we'll get it out there.
Absolutely. So real briefly, so a lot of that stemmed from the publication in the news media of a protein in a woman's body called syncytin. All right, and that's a protein that's found essentially in the developing placenta. They thought that there was similarity to that and the protein that's in the spikes, which is what the messenger RNA is made of. Pfizer came out with a statement clarifying that there is no distinct similarity between those two proteins, not at all. So there will not be any known fertility problems after receiving the COVID-19 vaccination.
Okay, thank you. This is from first name D, Dorsey. Can you get COVID in between the 2 doses?
Yes. Yes. So that's why we said earlier that second dose is of the utmost importance. There is some limited immunity that can be obtained from your first dose, but it's very limited. So yes, you can still get COVID if you fail to get that second dose. Absolutely.
Okay. Tons of questions, which is a good thing.
Questions?
Awesome.
we have a formal answer to this, but I think it's important that the families, hear that what we're thinking about here. So this is from Leslie. If you decide not to have the vaccine, are you going to be stopped from coming in to visit a loved one?
I don't think so. I really haven't been in a discussion. I don't know if we've got that far yet as to what we're going to do with respect to that. I would doubt it. I think again, I think we're more in encouraging people to get the vaccine. So, we'll have to wait and see what the CDC guidelines are with respect to that, and also what the state DHHR says.
Okay, thank you.
Yeah, okay.
I know things are rapidly evolving.
Yeah, that's a good question.
And then from Jessica Litton, this education is very important. May I allow my immediate family to listen in on tomorrow's call? I would like to arm them with this knowledge to share when discussed in our community. I can actually take that one, Jessica. I'll take one. Absolutely. So this webinar is for all of our patients and their loved ones, and all of our team members and their loved ones, however you want to define that. We want as many people to see this as possible, and don't get stuck on 10 a.m. tomorrow if you can't join. We're also going to post a recording on our website as well. So thanks for your question. I have a lot of repeats here. Bear with me while I keep scanning. Much of these are the same. I think most of these are covered. Here's one from Nancy. There's no last name for you, Dr. Malone. Are there any specific studies on people, who are in the age bracket of 90 and above that we could point anybody to?
Studies regarding the vaccine, or
it doesn't
COVID?
say, but I assume efficacy and safety of the vaccine if you're over 90.
Okay, not at the moment, no. I believe the oldest participant was, and don't quote me, I saw one where there was 92 years of age, but the ranges were 18 to 85 specifically. There were some outliers, but none younger than 18 and a few older than 85. And the main reason for that was not that they excluded them, but it's just difficult to get such elderly people into a study because most of them don't have transportation into the clinics and the hospitals where the studies were being conducted.
Okay, thank you. One more anonymous question. I have a family member who's at very high risk for COVID. They have liver disease, other health complications such as COPD, diabetes, and more. Will this be recommended for them, the vaccine?
Absolutely so, please.
Okay. I think I know the answer to this one, Larry, but I'll pass it to you first. This is from Cindy Naylor. Cindy's asking, what about short stay patients at our centers? If they're with Stonerise and they get the first part of the vaccine and then they're discharged, how is Stonerise or the state going to handle that?
We started those discussions. I don't think we have the state hasn't really clarified that, but we would definitely be offering the first vaccine, and we'll work out a way for them to get the second vaccine, even if they have left us and went back home.
Okay, thank you.
We don't have the details yet, but we're working on that.
Okay, and I'll give this one to you, Larry, and you punt it to Dr. Malone if you want. But for Stonerise employees, I'm reading the question. For Stonerise employees, what is the time frame for when this will be available to us? And remember, I think we've got chaplains on the phone, home health. We've got a lot of different segments of employees on the call today.
Sure. We'll start next week. We think on Tuesday, and the plan for the from administration, from National Guard, DHHR, and our team is that everybody will be vaccinated or have the opportunity to be vaccinated within the next 2 weeks, starting Tuesday. So somewhere around Christmas, we hope to be finished. It'd probably go a little bit longer than that, but the governor is allocating the first 2 weeks of vaccine to take care of our patients. and our employees and coworkers, not only us, but also assisted living. And so we're very, very thankful for that opportunity.
Okay, great. Dr. Malone, got a different one for you. So anonymous as well. What if you had the virus recently, but you don't know, or you have it now and you're asymptomatic? Would it be dangerous to get the vaccine within 21 days?
That's a great question, actually. And the answer would be no, it would not be dangerous. If anything, if you were an asymptomatic carrier and you had the virus, in theory, the vaccine should actually help augment your body to produce the antibodies. So no, it would not harm you.
Okay, thank you. More for you, Dr. Malone. Anonymous as well. If you do get COVID between the 2 vaccine shot doses, can you still get the second shot?
The answer would be yes. But again, the advisory committee, which will give their recommendations in the next 72 hours, they're going to direct us more upon that. So personally, at this point in time, I would say yes, but we'll have to wait until that comes out from the advisory committee later this weekend.
Okay, thank you. Another anonymous one. I've heard that the vaccine will not prevent COVID. It'll only lessen the symptoms of COVID. Is there any truth to that?
So vaccines can do 2 things, essentially. One, they can prevent illness, which means the symptoms of a disease, or 2, they can prevent the disease itself. So to date, so far in the trials, it looks as though it prevents the illness of the disease and quite probably the disease itself. But with any vaccine or medication, the trials and the studies will be ongoing over the course of the next couple of years. And we'll know more about whether it actually prevents the illness or the disease. And if it makes you feel any better, they actually still do those studies on flu vaccinations as well. We know that even if you prevent the illness of the disease, in other words, the symptoms, that still markedly reduces hospitalization and death. The end point, the outcome, is to reduce somebody from getting sick and death.
Okay, thank you, Dr. Malone. We'll just do 2 more. We promised to end at 2:45. So Larry, we've got a couple of different questions asking the same thing. Is the vaccine going to be mandatory for Stonerise staff? And is that different from other healthcare providers across the state?
No, it's not going to be mandatory. So we are a freedom loving state. So we're encouraging people to do it and our coworkers, but it's not mandatory. And we're not aware. I'm not aware of any other healthcare provider in the state of West Virginia that has made it mandatory. There could be someone out there, but before we made our decisions, we did consult with a couple of the major hospital systems and along with some of our colleagues. So, and we think it's the right thing not to make it mandatory. We have a very educated, intelligent workforce, and we think once they see the facts, they'll be able to make the best decisions for them, their families, and our patients.
Okay, thank you. Dr. Malone, last one for you. This is from Joe. So if I have a medical procedure coming up, should I wait until after to be vaccinated?
Not necessarily. I think it would depend upon the procedure itself. And of course, most medical procedures, although not all, will require you get COVID tested prior to the procedure itself. So I would just talk to the surgeon or the procedure physician in order to get more guidance on that.
Okay. And I told a fib, I'm going to do one more. So Larry, we've also got colleagues on the phone today from Ohio. Have we learned anything about how the vaccine will be distributed to employees in Ohio yet?
No, it sounds like that Ohio is just a little bit behind West Virginia. Kind of what's happening in every state is getting a certain allocation, and then it's up to that particular state as to how to allocate it in these early stages. So Ohio, I think, is taking more of a preference towards hospitals and hospital employees. So we don't really have clarification there. I know I spoke with one of our colleagues in the skilled nursing business in Ohio yesterday, and they felt like they would be somewhere around the first of the year. So just rolling out a little differently. But again, there's a lot of expectation as we start with these smaller allocations. I think this week West Virginia got 16,000. That the allocations by week are going to go up exponentially over the next few weeks and months. So hopefully soon.
Great, thank you. Well, for everybody on the call, I know we're talking to employees, to families, to people in the community. We really appreciate it. We thank you for your attention and all the questions. I got through 44 of 88. I know some are still duplicates. So again, we thank you for your interest. We know there's more to answer. Stonerise obviously is not the end-all be-all authority on the vaccine. So we have to depend on the CDC, FDA to answer more questions. But we are able to answer some stuff. And if you visit our website, we've got the link on the slide in front of you. We'll do our best to keep up with frequently asked questions. And we also intend to post the recording of this webinar no later than Monday. Larry, Dr. Malone, thank you so much. Hope everybody has a great afternoon.
Thank you.
Thank you.